I'd like to ask your permission to both of you use this video for educational purpose and on internet.
Oh yeah, yep.
So tell me, what were your symptoms before the surgery?
I had weakness, numbness, paralysis in my left leg. Couldn't do much. The back wouldn't let me do nothing. Couldn't sleep.
How long did you have those symptoms?
2 years.
2 years.
Walking with a cane.
Yeah.
You know.
1 to 10, how bad was the pain?
That was like a constant 10 or more.
10 or more.
Yeah.
Describe for somebody who hasn't had that kind of pain, what your daily activity was like with constant pain like that.
Daily activity, I didn't have much. Just walk around as much as you can.
Yeah.
Try to help out with the house. Couldn't vacuum or laundry or nothing.
So you had some previous surgeries, right?
Yeah, 3 of them.
Tell me about that. No names, but
Yeah.
what did they do? Did it or did it not help you? Tell me about
I've had 3 microdiscectomies,
Mm-hmm.
and the first one was okay. That worked for a while, but 2 and 3, nothing.
Nothing. Now, the surgery, our surgery, was a minimal invasive transcambine OLLIF, and we did that surgery for 2 levels. Is that correct?
Yeah.
For bottom 2 level. And I'm going to turn around and show that the bone is growing in both levels, back and forth. All the screws are good, bone is growing. Now, I think the special thing about that surgery is that we did not do that surgery in a hospital, right? Tell me about that. Do you remember the surgery?
Oh, I do, yeah.
Tell me, how did it go?
I had it in the Maple Grove Surgery Center, and the pre-op was great. The specialists that were there with Dr. Abbasi were good. Nursing staff was excellent.
Mm-hmm.
And
But so you came in the morning, and how long after the surgery did you go home?
I think I got there at like 7:30 in the morning. I think by 1 o'clock that afternoon I was going home.
Yeah. Now, we talked about your pain. That was really bad.
Mm-hmm.
Now, let's talk about only leg pain. How
Okay.
bad is the leg pain now?
No leg pain, just like nerve sensations.
So we'll talk about that. The leg pain that you had, you said was 8, 9, 10 before the surgery.
Yeah.
When did you notice the leg pain is gone?
The second I woke up in recovery room.
Do you notice the leg pain is not there anymore?
Yeah, it was gone.
Okay. Did it ever come back, the leg pain, after that?
No.
No? But you do have some numbness on the top of the left foot on the big toe, right?
Yeah, I did.
So describe it to me.
It was dead and cold for about the first 6 months. 9 months out, I started getting the tingles and the burns, and now it's been just over a year, and I get it like electric shocks, and the toes starting to move again.
Okay. And that is actually what I describe to all my patients. Most of the patients even don't get that nerve irritation, but when you get it, sometimes your nerve have to grow from all the way from your back to that area. And usually nerves grow about an inch a month. So that makes sense that it takes more than just a week or 2 or a month or 2 for the nerves to reach that area. And sometimes when the nerves make connection, people describe to me this like a jolt, like a zap going down to the foot. When that happens, usually people are 3 months before things become normal. So that is in a way a good sign. No different than when you sleep on your arm. It's limp at first, but before it becomes normal, you get a zapping going down to the fingers. So that feeling is actually a good sign of the nerve connecting back. And it's not by coincidence that when you get these zaps, all of a sudden you notice that now you can move that toe even better. I checked your strength. Strength is good. And that is the only symptoms left, right? The numbness on the top of the big toe. Is that the only thing left?
Pretty much that, and
Okay.
some muscle soreness in my lower back. But
Yeah,
like I said,
mhm.
I've had 4 surgery, and I'm 40 years old.
Yeah.
So,
Now, how's the back pain overall?
probably like 3 most days, sometimes a 5. But usually I just take ibuprofen and start working, and it subsides.
But that was before the surgery. How bad? Before
Oh, that was like a constant 10 where you're thinking about
Yeah.
running into a tree.
Yeah. You asked me something today that about you moving and so on, activity, heavy lifting and so on. Now, overall, I think you can go back slowly to usual activity, but as usual, I didn't make you a superhero, so still use your discretion for excessive things. Okay.
Yeah.
one more thing. Your BMI at the time of the surgery was 41.
Mm-hmm.
Many doctors in our profession, they say, never do surgery of kind that we did with that fusion, BMI above 40. Not only we did the surgery, but we did it in a surgery center, and you went home few hours later.
Mm-hmm.
Okay, so did you have any experience talking to surgeon who said you cannot have the surgery? Did you have that experience? Not a fusion. Did you get that experience?
I had 3 just tell me no because of my size, and 1 gave me a 45-minute seminar on weight loss.
Okay, so 3 told you you cannot have the surgery, and the other last one told you you just have to lose weight. And
Yeah,
now
it's 'cause it's too high risk.
yeah, how does one lose weight when you cannot walk? You have pain.
That's what I asked them.
Yeah, what did he tell you?
They said eat less.
Well, I apologize. That is not funny. It's just I'm unhuman. You know, just put all the burden on your back. So now, overall, happy with the results so far?
Oh, very much so.
Okay, well, I really appreciate this interview. And by the way, I love your T-shirt. I want to get a good view of it, okay?
Social media shirt.
Yeah, you will be actually on social media. Thank you very much, okay? Thank you.
Thank you.
Thank